single one of us would love to consult a doctor and get medical treatment as well as prescriptions the moment that we feel pain. However, that's not the case. Going to the doctor requires transport, and the doctor itself can be expensive. Like if you go to a private hospital, they could charge you 400 rand just for a consultation, excluding the medication itself. So as much as we would all love to um, get medical attention whenever we do feel pain, unfortunately it's not always the case. You have a stomach ache? Don't worry, take some vinegar or some lemon juice. That'll make you feel better, because the initial assumption is it's a stomach ache. Unbeknownst to you, it could be something more severe, i.e., appendicitis, also known as what I went through. I started experiencing unbearable stomach pain on one Saturday night, and I thought that I was full. Like my stomach, I literally said that my stomach had retired on me. So then I went to sleep thinking I'd sleep it off, but I didn't sleep anything because there was pain um in the middle of my stomach and around the navel. So I decided to puke. I made myself puke and it gave some temporary relief. But then my body was on auto puke lit, and it just kept vomiting and vomiting, and I would just wake up, my mouth would water at around 3 in the morning, and then I realized that I need to release this stuff. So I did, and then I realized that I wasn't okay. I would experience constant stomach pains. So then I would drink some water, I would drink vinegar, I would also drink stuff for acid reflux, and I would sleep a little. Then I went to the hospital. So I thought that my stomach was just full and some of the liquids needed to be dissolved or removed. So when I got to the doctor, I told them about the pains I was experiencing, as well as the fact that I did have a big dinner, which was the case, and they gave me a trip, they gave me meds. So then I took the meds, went back home, I slept for a while. After the nap, I was in even worse pain around my stomach area. Everything was just hurting, especially the bottom area. Like some areas in the stomach were fine, but like the bottom was easily the worst. So then I remembered that I gave it 24 hours because I remembered that the doctor said that if I'm not feeling better within 24 hours, I would have to be admitted into the hospital. So then I gave it a chance, uh, took the pills, put a hot water bottle where I was feeling cold and in pain, and then it was fine for some time. Then I went to sleep. Scratch that. I attempted to sleep because I was too busy looking for a comfortable position with all that stomach pain. Oh my gosh, it was so horrendous. At night, I couldn't wait for it to be morning for some reason. I then I bathed. After that, I tried to get some sleep, take the pills, and have breakfast and lunch. Oh my god. Do you have any idea how hard it is to eat cornflakes when you're not feeling like eating? And like the milk as well. I don't know if it was just the smell of the food, but it was so absolutely horrible. Some time passes, I take painkillers, eat some wonton, sleep a little, still in pain, and decide that it's been more than 24 hours, so it's time to go back. And standing up was horrible, terrible even, because it's like I couldn't get up straight. I was there just like looking like, I don't know, a camel. It was so bad getting in and out the car. When I got into the doctor's office, I begged him to lie on the bed on my side. But then when he was examining me, he made me lie on my back so that he could poke at my stomach, and it was so painful laying on my back. It just felt like the pain was coming crashing down on me. I was breathing heavily, and like when he was poking around, it was painful at the lower part uh to my right and in the middle, and then he's like, she's sick. So then we went to another doctor. They also poked around at me, and they made like an ultrasound, uh something of an x-ray. So I heard them talking like that something is ruptured, the appendix is ruptured, and that's when they said that she has to do an operation. And then I asked again, I had to do a double take. I'm doing an operation. So that's what it was. That's how that's how I got like admitted into the hospital. So I had to go to a third one in that one night. It was a public one, and the ultrasound was done again, and then that's when they said that they had to do surgery on my appendix. Did I cry? Yes, because I'm normal. Of course I cried. I was distraught and I was worried because I was going to spend the night in a place that I did not know, first of all. And bro, it's surgery. Who isn't scared of surgery? And then the doctors are looking at me like it's weird that I'm scared. Like, okay, like bro, is we serious? Are we really doing this? Surgery at that point, I had seen it on TV, and I'd seen the terminology they use, like ward, theater, and stuff. So when they first uh, pushed the bed to into the observation room where they were conducting another ultrasound, things started to feel real. I felt like I'm a patient in a hospital and it's not a movie. So, got pushed. I'm not gonna lie, it was actually kind of fun. I enjoyed being pushed in the bed. But anyway, so after the ultrasound, I was able to sleep a little, and then they transferred me, would push the bed again like a go-kart, to the ward where I was sharing like the room with other patients, and they said that the operation was tomorrow. They turned off the lights, and one thing about those hospital beds, they are comfy. Like the blankets are just the right amount of warm. The bed is soft and it's like adjustable to my knees. Like it was so easy to sleep. So then they put in the trip, and it was there. So I awaited the next day. It was time. It was time. They uh, took me out of the bed, put me on a wheelchair, which I enjoyed very much, given that I had already enjoyed being pushed on the go kart bed. So then I go out um, on the wheelchair, and then I get like placed on the I get placed on the, what is that place where they do the surgery? I don't really remember. I don't know if it's another bed or a cutting table, but I was placed there, and they kind of they removed the top part of like the shirt, basically around here, and I laid down, arms out. Uh, as they asked me how I was, so I wasn't in as much pain, honestly, and I looked up. They gave me the oxygen mask, gave me some injections. I started to feel sleepy, and in my mind I wanted to like pinpoint when I would fall asleep. So then I didn't know when I fell asleep, but then woke up and I'm like I couldn't breathe and I felt like there were bandages and like all types of stitches on me and I was like moving around shaking and then they put me down. I did it again. They pushed me down and then I said I can't breathe. They put the mask back on me. It was a little bit scary, but it was nothing. They were done and I was relieved. Obviously, it's important to mention that they said that I couldn't have food or water for some time, and I was thirsty when I had arrived, but the trip it refreshed me. But I did get like sores on my lips, and ever since I rehydrated, they've been able to go away. But uh, the following day, I woke up and it was it was the big day. It was the big day. They gave me the um the green shirt that the patients wear, and I hate that shirt so much because it does not have a back at all. So if you make one mistake, you are flashing the other patients. The next day, I still wasn't eating, but then I got used to the routine. I would like bathe in like using the sink. I would get to rest. I would get my injections, watch my phone, some videos. It was kind of a vibe. You know, the injections aren't painful when you get used to them, but the trip when they put like all those liquids in you, it does get kind of crazy. Like something is being thrusted into your arm. It's not an easy experience. The day after that, I did not enjoy it because it was the day I was introduced to food and um maybe them giving me porridge was not the greatest thing given that I hadn't eaten for 48 hours or drank anything. So I started off um, with water and then I tried to eat the porridge. Of course, it was flavorless. I'm in a hospital for crying out loud, but it was hard for it to go down, and I just had to use all kinds of like resilience and willpower to push it. Yeah. And like I was also watching Halloween Instagram reels. It was the 31st of October. I threw up. At around that time, the following day, I was not a fan of the smell of food, uh, the taste of it, and especially swallowing it. Water was the goat during that period. It really was, and I had to eat. I had to eat. I was scared of what would happen because if I didn't eat. So tried to get some cornflakes without milk, but they felt painful and dry. So then I tried to have some mashed banana and then I forced it down, but like I ate too fast and the smell was also annoying me. So then I puked again. And then I ate some plain yogurt very slowly, and it got me back into that groove of eating. Like you have to eat slowly and gradually. Another thing is introduce yourself to bland and soft foods. The spicy ones, you can have them maybe after a week after the surgery has been done, but like you want to eat the light meals. I myself was eating out of a tiny bowl and would get full because I had water and I would take the pills. Afterwards, I'd have some soup. It was nice and it was an easy digesting experience. As for my stitches, the doctor said that they would dissolve into my body or fall out on their own. So I've been cleaning the wound and have been trying my best not to get it wet when I do bath. I'm still exercising, walking around the house a lot more than 20 minutes a day, and I've been increasing it to even an hour standing up the whole day. It's been great, and I am really healing. So you can heal from appendicitis too. I believe in you.